Bueno, buenos días. Yo creo que ya podemos, ¿verdad?, comenzar para el beneficio, ¿verdad?, de los presentes y especialmente de los invitados que tenemos, pues vamos a cambiar, ¿verdad?, el idioma un poquito, así que vamos a presentar este taller en inglés. Welcome to today's workshop, Community-Based Participatory Research Addressing Health Disparities in Vulnerable Populations. I think that it is a very special occasion for the RCMI program, Research Centers in Minority Institutions at the University of Puerto Rico Medical Sciences campus, to really sponsor this particular activity. As many, probably of you know, the RCMI program was transferred from the National Center for Research Resources to the National Institute of Minority Health and Health Disparities in 2012. As a result of this action, we have been identifying activities that help us address NIMHD's mission to lead scientific research that improves minority health and eliminates health disparities. So it is very important for us that we, in this endeavor, identify and try to work with the communities that the RCMI program serves. So we all have to recognize that when research is conducted in issues related to health, new treatments and prevention of disease occurs. That's usually the good part. The challenging part is that sometimes transferring those new treatments and making them available to the communities, to the people, is really a challenge. And I think that that is especially the case with disadvantaged populations. And this is the reason, I think, one of the reasons to really sponsor this particular activity. So addressing this gap by conducting community-based participatory research is for us very important. And I will also like to mention that when we think of community-based participatory research, we usually think of their contribution in facilitating the recruitment of subjects. But it goes much more than that. I think the important role that community-based participatory research does is connecting the community members with the investigators that are conducting the research, and then sharing, even more important, right, those results with the community that participated in those studies. And I think that that's what we would like to see when community participatory research occurs. Our three guest speakers are not only expert investigators in the field of community-based participatory research, but are also individuals extremely committed to the populations that they have selected to serve. And I think that I'm very glad that, you know, we have this opportunity. In today's activity, I have to acknowledge that it wouldn't have occurred if Dr. Emily Wang, when I invited her to give the seminar, said, not a seminar, let's do a workshop. And I have two other persons that are willing to come and share their experiences in community-based participatory research with the investigators at the University of Puerto Rico Medical Sciences campus. And later, we open it to other institutions in Puerto Rico and other campuses at the University of Puerto Rico. And I think that we have representation from all of those here this morning. So thank you all to responding to our invitation. And thank you, Emily, for making possible, you know, this special activity. Beside Dr. Emily Wang from Yale University, who will share her experiences using the framework of community resilience to mitigate gun violence, we have also Dr. Uriyoán Colón-Ramos from George Washington University, and she will address the theory and challenges of community-based participatory research. Finally, and not last, Dr. Leopoldo Cabaza from Columbia University will discuss how he has used participatory research methods to inform the development of health intervention for people with serious mental illnesses. So I think that we really have a very interesting and exciting program to share with you this morning. Welcome us, and I will leave you with Dr. Wang, who will be monitoring this session. Dr. Wang?
Pues gracias por la invitación y para empezar es un gran placer de estar aquí hoy. De verdad yo me gustaría hablar completamente en español, pero mi español es horrible. Entonces, para esta mañana voy a hablar en inglés y pues dar mi perdón que yo no puedo comunicar completamente en español. So, it's a real honor and pleasure to be here and again. This is one facet component of the work that I do is really using this approach, community-based participatory research, community-based participatory research in certain projects to really think about how best to tackle some of the most, I think, insidious, difficult problems to address in healthcare. The bulk of my work actually is really focused on individuals that have a history of incarceration and how best to improve healthcare utilization within the prison systems as well as in the community. But today, what we're thinking of doing is actually giving you 3 different lenses through 3 different disciplines. So I'm a physician, Uriyoán is a public health nutritionist, and Leo is trained in the School of Social Work to really think about how to use this approach across disciplines, again, to engage disadvantaged populations, disenfranchised populations at all parts of the process of research and really thinking about how you can transform communities and our health. And so our hope is that it'll be an interactive forum, first and foremost, that, we don't consider ourselves, while we've been doing this for a bit, the sole experts by any stretch of the imagination in the work that we do, that there are real challenges as well as opportunities in this methodology, and we're hoping to really share with you those experiences. And that what we'll do is start first with Uriyoán. She's going to give an overview of what CVPR is, a little bit of the history, a little bit of the principles of CVPR. She will discuss her project, which is in the design phase. Then we'll turn to my project, which is has moved beyond the design phase and is now in the pilot data and now moving on to the kind of more robust scaling up in the intervention, and then finally end with Leo, who will present his work, which is now moved beyond the design pilot phase now into full-on intervention. And this will give you an arc, hopefully, of how CVPR can be used, again, in all stages of your work as it might apply, when the strengths, when the opportunities avail themselves to really think about this approach. So what I'll do then is really keep track of time. We're thinking that each presenter will spend about 30 minutes discussing his or her work, and then leave time, certainly if there's questions that arise during the presentations, feel free to ask away, but we'll leave some time at the end of all 3 talks to really talk about issues with CVPR in general, thinking about funding opportunities, thinking about how this might apply to your work here in Puerto Rico or across the world. So it's with that I will introduce Uriyoán Colón-Ramos, and she'll actually start off this morning.
Okay. I got it. Yeah. Thank you. Well, thank you so much for inviting me. My name is Uriyoán Colón. I don't have any excuse for speaking in English. I was born and raised here. My family is from Barranquitas, but I'm now in Washington, D.C., but I was asked to speak in English today, so you'll have to suffer through my English through this presentation. Oh, yeah. So just while this loads up, to give you a little bit of my background, I studied nutrition. I was interested always in kind of dietary disparities and why some populations are more vulnerable to eating certain things. So I'm very interested in the social and kind of ecological determinants of diet and nutrition. And I'm in the Department of Global Health in George Washington, so a lot of my work has focused on Latin American populations, and only recently I have started to establish collaborations in Puerto Rico, and I'm more interested in understanding more about what is happening in terms of diet here in Puerto Rico. But the work I'm going to be talking about today is actually in D.C., and it's focused on an African-American population in Washington, D.C. But first, I thought we would start with a little bit of theory about community-based participatory research. And I wanted to get a sense so that maybe it would help me target the talk better of who here works on community-based participatory research methods. Perfect. And so I'm going to go through some things that might be a little bit repetitive. But basically, I wanted to give a basic overview on why we do CVPR, community-based participatory research. What are the key elements of CVPR? And then kind of illustrate some of the challenges and issues that I've had with this particular project. It's called, or I titled it, Shaping Our Kids' Diets, Home and Neighborhood. And right now I'm at the design stage and recruitment stage. So we have started interviewing, and that's kind of where we are right now. And it will be a completely personal, honest view on how this process started, what were the challenges, and what I'm dealing with. So bear with me on that. And then potential solutions. I'm really looking forward to the discussion with the rest of the team. So to give an overview on what is CVPR and why we do CVPR. So traditionally in public health, we've been interested in looking at the social and ecological determinants, societal determinants of health. There's also an emphasis on randomized controlled trials, which are considered the gold standard to identify kind of the individual risk factors of different health conditions or diseases, morbidity and mortality. So the randomized controlled trials control for these social and ecological or environmental factors and emphasize the individual level factors. And that has advanced our knowledge a lot on diseases, but it's also creating increasing enormous gaps in how do we apply this knowledge once we acquire that knowledge. How do we better translate this knowledge into the application now of, and work with communities into the application of this knowledge and improvement of health. And it has also, it doesn't quite address the issue of health disparities as well, because we're looking at the individual, we're controlling for social and environmental factors, and we are also, as time goes, seeing an increase in health disparities, particularly in most vulnerable populations. So the rationale for CVPR is we have health disparities. We have a disproportionate burden of morbidity and mortality in low-income communities, most vulnerable communities, which also tend to be communities of color. We also have a gap between research and community practice. So in the cartoon earlier, you see kind of this bubble where the researchers are conducting their research, and are we actually kind of translating that and applying that. And then also exclusion. So we're systematically excluding the underserved populations and communities, and we're perhaps imposing some interventions on them or some solutions without necessarily fully including them in the design of these solutions or what would work best. So this rationale is basically, it's based on two major assumptions. And number one is that interventions are going to be strengthened by including the communities, by using the strengths and the resources in the communities, and that there's something about the process of CVPR that is also providing an added benefit or an added value into the interventions. So the proper definition of CVPR from Barbara Israel in 1998 is that it is a collaborative approach to research that equitably involves, for example, community members, organizational representatives, and researchers in all aspects of health, from the definition of the problem all the way to dissemination of information. And the partners contribute unique strengths and shared responsibilities. CVPR is kind of like a larger umbrella, but includes perhaps other terms that you might have heard, like participatory action research or feminist studies. But they all have kind of these similar pillars that are based on social action, partnership, knowledge generation, and capacity building. So we start perhaps with a desire to change, to have a social change or a social justice, to deal with health inequalities or health disparities. And from that desire, we may build partnerships, collaborative partnerships, all the way from the definition of the research topic to dissemination. And those partnerships are drawing, again, on those unique strengths and unique expertise of the community. So at this point, the researcher becomes more of a facilitator more than an expert, on the field. The researcher obviously is maybe bringing some expertise now, methodological expertise, but there's a large assumption that the community also has expertise on the etiology of disease or beliefs on the disease that are very important to how we're going to be applying an intervention, or we're going to be translating that knowledge. So that partnership is a very equal partnership, or that's what we strive for, to have a partnership that is diverse and that is equal. And there's co-learning. That's another key element. So knowledge generation and capacity building. There's co-learning. We're providing skills, but also the community members are providing skills. They're providing expertise. They're providing their network. They're providing perhaps the structures like churches and their own kind of social structure, organizational structure in the community. The community is also a unit in and of itself that the researcher and the community members recognize as a unit. So it could be a family or a geographical kind of community or a neighborhood, but it's defined, predefined by the community itself. So that's basically it's a social action, partnership, knowledge generation, and capacity building. Let me see if I forgot. There are about 8 elements that have been identified. I want to make sure I have talked about. There's another one, yes. It's like a cyclical, iterative process, and that's actually a very important one, and that one I'm going to be talking about a little bit more with my project. So it requires maintenance. It's a partnership that requires maintenance, that requires constant needs assessment. The partnerships might be changing. The key role players might be changing. The social and political situation might be changing in the community. So that's something that we have to, seems pretty obvious, but something that once we're doing the research, at least me, I have to keep reminding myself that, yes, I did this maybe 6 months ago or last year, but things have changed. Maybe there was people have left the community, people have come in, and I need to do a kind of an assessment again and build those relationships or at least maintain those relationships. So what's the difference between community-based participatory research and traditional research? It's different, again, in all the different steps. So all the way from the definition of the problem, where we're actually forming a partnership to identify what are the needs and how we're going to address those needs and what's the research question. That's a true community-based participatory research, as opposed to traditional research, where the researcher who obtains the funds comes up with a question, obtains the funds. And that's a real challenge, especially in the funding situation where, as researchers, we have an expertise in a particular topic, and we want to reach out to a community and see whether this is of interest. And we may or may not come with funding. And would that be considered community-based participatory research? Because we're coming already with an idea of what our question is or the question that we want to answer is. The organization of the methodology also should be done in partnership. And we'll talk a little bit about that in terms of the design. Also, collection of the data and analysis of the data. My project is not there yet, but Emily, I know, has a great example on the collection and data analysis where members were involved, members in the community, and Leo as well. And then the dissemination of the results, and the dissemination so that there's an action goal at the end, so that there's, and it might not necessarily be a change, but at least dissemination to inform all members in a respectful way and include others that might be involved in the well-being of that community as well. And that is also key. So it goes outside of the walls of the university. And CVPR also addresses some challenges in translational research. This is a slide from Leo Cavazos as well as some of the previous ones. But I like this slide a lot because I hope you can read it. It's a table that basically talks about challenges to traditional translation research and how CVPR addresses those. and we can see there's external validity. So when we're trying to control for some of the social or environmental aspects of it, CVPR actually engages community stakeholders within those systems, within those complex systems and cultural context. So the external validity of a traditional translational study or intervention study it is addressed that way. There's also a difference between CVPR and traditional methods of translation in terms of privileging academics with the evidence, where the evidence stays within the university, whereas CVPR creates kind of like a diverse community space where we're drawing from the expertise, there's that co-learning aspect of it, from the community as well as academics to understand what is happening with the evidence and how this intervention is actually being applied or not applied, working or not working, and why. Language, incompatible discourse between academia and the community happens with the traditional translational research versus CVPR that really creates a space to broaden the discourse to include social and cultural meanings. Again, here this is talking about business as usual within the university, so we're staying within the walls of the university, kind of like armchair anthropologists, taking the data in and studying it, versus CVPR that shifts the power dynamics. The researcher becomes a facilitator. The lines are blurred a little bit in terms of the different roles that folks are playing. So it's bidirectional learning, collective decision making, which can be challenging. An outcome is also should be beneficial to the community. There's a question of the sustainability of a program. CVPR should be integrating programs within services, and there should be local ownership and capacity development. So that's how the kind of like textbook CVPR should be working versus more translational, traditional research, which is funding is done and we're done and we're out of here. And the issue of lack of trust. Lack of trust is always going to be an issue where researchers are in kind of textbook CVPR. The ideal, what we strive for, is that we use formal agreements and we sustain long-term relationships. So that can also be a challenge, because we have a specific timeline, especially if we have funds, and if we have not created those partnerships and those long-term relationships, we might not be able to actually do a very good CVPR type of work. And we will end up, with hybrid of CVPR, but there are issues of lack of trust. And so I think you'll see some of that with my work. So these are also textbook challenges to CVPR. And there are many, many different types of challenges to CVPR. I have just organized these, drawing from the publication of Barbara Israel. Also, she organizes them into 3 basic categories. And it's challenges to the establishment of a partnership, methodological challenges, and kind of like broader issue challenges. And these are just some of the examples that I found most salient that she talks about. So challenges to establish a partnership, identification of common goals, a presence of a community organizer and support team. That's a big one in my view. Is that time? No. And the researcher versus the facilitator. So the expectations of the role from the expert coming in and feeling like he or she is an expert, as a researcher, which might put off some of the community partners. And the representation of the community is also key. So at some points, you will see, I think, with my project, you think you have a good representation, you have a good collection of the leaders of the community, and only with trial and error you'll realize that the community that you were trying to reach wasn't actually being represented, perhaps in your community advisory board, or somehow you couldn't reach it. And so the issue of representation of the community, while there are ways, kind of systematic ways to identify community leaders, could also lead you, there could also be ways in which you're led astray in terms of getting like a false representation of the community in your collaborations and partnerships as you're starting. So methodological issues, which is another larger kind of category of challenges to CVPR. The question is still the scientific rigor of the types of study and proving the intervention success. So you're working in a community, and you're working with community partners, and could the success, if you're working on an intervention study, could the success of that intervention really be due to this methodology or to the kind of CVPR intervention that you did, or could it be due to other issues that you didn't control for? But that was the whole point. You didn't want to control for some of those issues. So, but there are questions that arise in the academic world about the scientific rigor of this type of research. There's an inability to pre-specify all the aspects of the research up front, and that's inherent to the design of CVPR. But how do you obtain funds if you're unable to pre-specify exactly what you're going to be doing before you actually form these partnerships? You wait then to have those partnerships, but then it's catch-22 now. How do you start establishing these partnerships, et cetera, without funds or with limited funds? And also a balance of research action that ties into the broader issues of academia and tenure and promotion. So the researcher becoming an activist versus publication, bringing in collaborators from the community for publications, whether that's of interest or for data collection and data analysis. Is the project leading too much to social action and community organizing and not as much to academia? Then what's in for the partnership for the academic partner? And then the other way around. And then the broader historical, social, and contextual issues, which I'm sure you can imagine are many. So competing institutional demands. So academics will have the issues associated with tenure and promotion. Some of the community members or community participants might be volunteering their time. And sometimes it requires a lot of time to sit on these meetings and to establish this relationship. So is it fair to ask them to volunteer their time? Sometimes they're in many different committees. How do you compensate them? How do you make it more fair, for them? Expectation of funding institutions with a given timeline without taking into consideration the needs of the community or the rhythms of life in that community is also a challenge. And of course, there are political and social dynamics in the community, changes that happen, political changes that happen in the community, people leaving and people coming, instability in the community, especially for low-income communities where there might be even violence. I have found that there's a lot of kind of coming and going, depending on what is happening, and seasonality issues of the community as well. So CVPR in nutrition. Now this is really, I'm just going to walk you through this very personal process that I went through. I have had experience. One of my other projects is looking at Latino communities. We're forming a community coalition where we had a mission goal, and we have an established relationship. The university has an established relationship with this particular community of Latinos in Maryland. So it's a little bit easier to work there to establish. We're identifying strategies and interventions to address poor nutrition in this community. It's a community largely of immigrants. This project that I'm going to talk to you about is the complete opposite. It's in D.C. So let me say that. So here's a map of Washington, D.C., that square over there. So it's in D.C. I'm relatively new to D.C. I think I'll be saying that my whole life. But I want to say when I started this, I was definitely very new to D.C., and I wanted to understand what were the issues of nutrition and I wanted to get to know a little bit more of the community that I was living in and understand what were the issues that they were going through, especially in nutrition. It's a completely different community because the university doesn't have any established presence in this community. And in fact, historically speaking, there's a lot of friction with the community in this particular community. There has been a lot of kind of in and out and bad blood between the community members and the university, especially with the past president in decades ago. But that history is still festering there. I didn't know this when I naively went in to do this. But DC, this Ward 7, which is this red dot here, and Ward 8, which is down here, are predominantly African American. They're east of the Anacostia River, And they're kind of like the forgotten DC, corner of DC. It's 33% of the population that lives below the poverty level, and there's over 35% adult obesity prevalence. And I couldn't even find numbers, representative numbers for childhood obesity. But it has been denominated as a food desert. A food desert is a low-income area that lacks access to grocery store or healthy foods that are affordable, that are quality, according to the U.S. Department of Agriculture. So because it has been denominated as a food desert, and because we've been speaking about health inequalities, this area of DC has been bombarded by services. In the realm of nutrition, there are a number of nonprofit organizations that receive federal funding and local and state funding to address the issue of lack of access to foods in this particular area. So this is DC Central Kitchen, which is one of our partners in this project. They provide fresh fruits and vegetables and other kind of healthier foods like granola, snacks, to corner stores, because there are no grocery stores. There are only corner stores. And corner stores traditionally sell some of the highest caloric foods and have grossest kind of foods that you can find. And there was a concern that people couldn't prepare meals out of scratch, that they couldn't really feed themselves and had to travel all the way to Maryland. Some of these folks, many of these folks don't have cars. So there's a question about where they're obtaining their foods, and the theory, especially drawing from all the work that has been done in Baltimore, which is our neighbor. We have a large initiative. They have a large initiative from Hopkins in Baltimore where they study a very similar population of African Americans, kind of similar setting, and most of what the understanding is that most of these folks are consuming, the foods that they're consuming are coming from the corner stores. So DC Central Kitchen has a Healthy Corners program. DC Greens also offers farmers markets that are very seasonal. It's only in the summer. Farmers markets where they have a double value coupon where you can bring in basically your food stamp and obtain kind of a double value of fruits and vegetables for the food stamp that you're getting. Wholesome Waves also has a coupon that is basically given to you by your doctor. So they call it what's the word? It's like a referral, like a medical referral, where your doctor is for kids. So doctor says the kid needs to eat more fruits and vegetables. So here's a coupon, and go to the farmer's market, and you'll get them for free, basically. Wholesome Waves is kind of paying for it. So there's a wealth of programs. That's only a couple of examples that are addressing kind of poor nutrition from the question of food access in Ward 7 and Ward 8. So I started talking to the representatives of these organizations, trying to understand, what are the other issues? How can I better help? How can I get more involved? And who's using your services? And they had absolutely no idea who's using their services, how they're using it, who's buying them, or whether they're buying them or not. We would go to the stores and see sometimes, some of the stores you would see some of the spoiled items. So every week they come and change the foods. And in some of the stores they were selling some items. In other stores they were not selling anything, and they were basically replacing it. So one of their concerns was, we would love to know who's using our services and whether they want other services, what else they want. And I was surprised to hear, I was kind of naive in thinking this, I think. I was surprised to hear that in their community advisory boards, first of all, they didn't have a community advisory board. And secondly, the ones who didn't have members of the community, like people who live there and or work there, who would inform them about this community. And there's also a racial divide between the folks who are providing the services and the people who are receiving the services, mostly African American, and mostly white people who are offering the services. There's also a racial divide between the owners of the stores, who are mostly Korean or Ethiopian, and the folks who are using the stores. And if you go into one of these stores, well, there are stores where you're basically not even allowed to walk into the aisles. Everything is kind of locked behind, and you tell the person, there's kind of like a glass, a bulletproof glass, and you tell the person, I would like, a bag of Doritos and this and that, and you exchange money that way. So that doesn't help for the community trust with the corner stores, and I don't think that was helping the program of Healthy Corners. So originally I thought I would love to design an evaluation program. I was very interested in understanding how young children in these communities were establishing their eating patterns. So I said, well, let's establish an evaluation program where we start 2 different stores at different times. You know, we have a kind of like intervention store and a control store, and we're looking at families, and we are looking at what's available in the home, because a lot of the calories that these children are eating, especially the younger ones, were available in the home, in addition to schools, no? But I already knew what was happening in the schools. And as I thought more about it and talked more to the partners, I realized I needed to take a step back and understand really what were the needs of the community and what were the major barriers to obtaining food in their homes. And I wanted to focus on healthy foods, but I didn't want to provide my perspective on what I meant by healthy foods. I didn't want it to be a judgment. So the original question then, when I took a step back, was kind of which strategies best support healthy food acquisition at the homes of low-income urban families and their children. And for that, the rationale was that urban low-income residents frequently shop in small food stores because larger supermarkets are out of reach. And we know this because of the Baltimore Healthy Stores. We know this because of other interventions that are happening in Pennsylvania and other parts of the country that are similar. We also know that foods available at home are a key predictor of children's diet and obesity. We have a limited understanding on how home food acquisition actually happens, and this limited understanding poses a critical barrier to create sustained intervention programs. So my idea was to really understand which strategies would work best with home food acquisition so that we could start a sustainable intervention program with strategies. This is a conceptual framework, but in brief, it's a social ecological framework, just emphasizing micro level environment, physical environment, social, and then individual factors, and the focus of foods at home. So this was our objective and long-term goal, which I already spoke about. I'm speeding it up because I got a 5-minute mark. But in this project, which is funded by the George Washington Center for Civic Engagement, and this is a little bit like seed money, no? Because it's a community assessment. I wanted to first establish the partnership and the trust before thinking about applying for funds. I wanted to create a community advisory board from scratch in a place where the university has bad blood. I didn't know that when I first started, but this is kind of like the main aims. Create a community advisory board, conduct photo voice interviews with parents, and then have a culminating workshop where we're inviting parents, we have our community advisory board, and also policymakers, and opening up to other stakeholders to display the pictures from photo voice and say these are the issues that parents are facing, these are the barriers and the motivators, and let's think about strategies, and let's think about most efficient strategies that we can incorporate, maybe things that are already happening, and maybe things that need to be created de novo. So for the creation of the community advisory board, as I mentioned, I was starting from scratch. Who should I talk to? I conducted internet searches, word of mouth, talking to other researchers and community organizers, and conducting basically relational interviews, face-to-face public relational interviews where I would meet with them, sit down, talk about personal history, really make it very conversational, kind of what were their visions, needs, and passions, and did it make sense to synergize? So we talked to them about the project as well. And I made it about the project, but I also made it about myself and the university and establishing a partnership that could also benefit them. And how could we and the university and my department help in that aspect, in that endeavor? And then I went kind of full circle where everyone kept mentioning the same names of the same people. So we ended up with about 12 members in our community advisory board. Here's a picture of our first meeting. And we had involved parents, representatives of organizations who were working on public health or food access, not necessarily nutrition. And we had community organizers who were working in churches and early educational systems as well. And they helped for about a period of 5 months. They were very deeply involved in the title of the project, which the original one, I can't remember what it was, it didn't like at all. So this is their title. The design of the recruitment materials and recruitment strategy, so offering $25 at the end of the photo voice interviews for parents and have it be cash as opposed to a gift card. The refinement of the interview protocol, and we also pilot tested constantly to make sure that it made sense what they were saying. So when I first started, I would give them a camera. I was pilot testing the photo voice interview. We'll talk about photo voice in a second. Give them the camera, and they would go with the camera and then come back a couple of days later, and I completely forgotten to take pictures. I'm supposed to take pictures. What was the project about again? Oh, yeah. So we went through systematic steps to identify what would be the best way. And they also committed to identifying to help recruit parents and participate in the culminating workshop. So, and I also, throughout this kind of 5-month period, I worked very hard at maintaining those relationships. It was time-consuming. I tried to connect them with students and with student organizations, try to identify what needs they would have because they also wanted funding. They wanted to jump right away at opportunities and wanted to see action right away. They thought this was a program or an intervention that I was going to be providing food or that I was going to be providing nutrition education. I had to constantly be reiterating, no, this is more like a listening session. I'm just trying to understand first what are the issues because we don't know that. But that took a lot of maintenance. Identification of funding resources and opportunities, identification of talks, conferences of interest for them at the university, and also my own networks and the academic networks that they might be interested in learning about. So the photo voice interviews are participatory. It's a strategy that's participatory, where we're asking people to create and discuss photographs to catalyze personal and community change, where people take the cameras and they document the reality of their lives. So they use the power of visual image to communicate their life experiences, expertise, and knowledge. What we decided to do was have a first meeting where I asked them to walk me through their day. It's about 40 minutes. And in that, I kind of remind them, that kind of reminds them through what their typical day looks like. And then I ask them about, well, you know, what did you feed your children for breakfast or for lunch or this and that. Throughout that period, they talk about kind of what made things easier or harder. Then they go take photos, and then they return the camera. And this is basically the interview, guys. So walk me through your typical day. What would you like to feed your children? Is it different from what you're giving them now? And what makes it easier or harder? And I would write those down, what made it easier or harder, so that they knew specifically what they had talked about. And then I asked them, what would illustrate that? You mentioned this. What would be a good picture of that? What do you think would represent that? And they would come up with ideas of things to photograph, and I would write those down. And after I had a couple, we had gone through their list, I said, now I want you to take this camera or use your cell phone and take pictures of that. And do you want me to remind you through text, you know, in the next 3 or 4 days that you need to take these pictures? And they would say, usually they would say yes. But it's still a work in progress. So far, we started the interviews in October. And so far, the CAP members have helped identify 10 parents, of which only 7 completed the first interview, and one of them never wanted to come back to bring the pictures or complete the second interview. And of course, we ran into December, and I think there's a seasonality issue there, so we'll retake that. So my diagnosis on what are these challenges is that there's definitely a lack of trust between the parents and us. We're conducting the research. I started conducting the interviews, then I had research assistants that I trained to do that. And I also wonder about the CAP familiarity with the population, just the fact that they have been able to identify 10 parents and not more. And so I'm exploring also that option. The issue that interviews were conducted in October through December, so there's a question of seasonality there, so I'm going to retake that in January. And I also wonder, I'm not going to go through what we have identified, though I have those slides still. We have time, we can go through those, kind of like the topics that have emerged in the interviews that we have done. But from the preliminary investigation of those, doesn't seem like nutrition, this population is very unstable. There are issues that we're talking about that are basic needs like violence, homelessness, job uncertainty, partner violence as well. And food and nutrition issues seems like an elite, the way that they're seeing it seems like kind of like an elite problem. The way that I see it is like everything affects our well-being, and we need to address the basic factors first. We need to do that first in order to see first, in order to then continue with nutrition. But the way they see it, they say, well, we're not ready to talk about nutrition yet. Don't talk to us about fruit and vegetable. And when I come in, or my research assistants come in, they will hide, they have, ¿cómo se llama? Like a pork skin, chicharrón. They will hide the pork rinds, they will hide, and I have to tell my research assistants, tell them, I don't care, I want to see that, I don't care what you're eating, I'm not a dietitian, I don't really care, but that's not really flying right now. So I'm regrouping with my CAB, and with the next steps that we have identified is that with the parents that have completed the interviews, we're offering an additional $10 if they refer us to their friends, and their friends complete the interviews, of course. Also, identifying parents and training them to be the research assistants to conduct the interviews themselves. And the community organizers are really, really emphasizing that we present this work as governance of their own communities rather than research from GW. And I'm thinking that's what I always thought we were doing, but apparently it was seen with the IRB, especially when we have to show them the IRB and informed consent form. This is research from GW. I'm doing something for you. I'm doing a favor for you. So we're reworking on how to present this. And I'm also toying with the idea of involving students through service learning to conduct the interviews and to establish a relationship, because I think that students are at a different level than faculty. They're able to have more time sometimes, typically. And also they have if they're very culturally competent, they have a good way of connecting, and also helps them academically and professionally. So we're working with a GW iScope Center. So that's the end of my presentation. These are our partners that are for this particular project, and I welcome the discussion later on.